When they give birth?
Long time.
Was that cesarean section?
10 years old.
Huh?
Why she go for cesarean also forget?
Last time, no, because the puppy very big.
No.
This one is a 16-year-old Russell. Female, not spayed.
I don't know why she come here for one.
This solitary tumour. On the left, MG 5. Let me see whether it's spread or not. No. Maybe, but it's just surprising it didn't spread. Not sterilized. Not spayed. This is spayed or not spayed? Spayed already, right?
Okay.
Does she have period?
她没有烟了哈。Okay. No, not spayed.
Does she got the period every month, every 6 months?
No more already.
When did she stop?
Long time ago. I think last 2 months she got, but only 1 day only. Very little. Then after that no more.
Yeah, surprised didn't get this pyometra. I call it infection of the womb. We call pyometra for old dogs, old female dog. Never get so. And appetite is still good. No fever.
Appetite very good.
No fever, so yeah.
She eat a lot.
So only 2 days ago can't sleep, 24th of December. Why can't sleep? Painful.
Don't know. She just walk up and down, then like
restless. No, this blue thing is no good. You know, this blue can become gangrenous.
So take up
the blood vessel. Yeah, the blood flow not so good already. Normally it's not blue. Normally it's just a skin color like this. Blue means like changing to gangrene.
Gangrene is what?
The blood supply died already.
So meaning?
Then becomes blue and after black, no more blood supply, no.
So it will shrink.
Rot, yeah, rot and smell, and then bacteria comes in, no. So because rotten flesh, ma.
So no good lah.
Yeah, no good for dog. This color is no good, right? This color.
I thought rot, then it will shrink.
No, it rot. It will smell like rotten flesh like that. There's one small one here, near there. One small one. There. Oh, this small one. Yeah. Probably started like that, a small there. Like peanut like that, small peanut. Then after that, but it didn't spread, you see, that's the beauty of this one. So do operation.
Because I pray every day.
Really?
Pray to the God.
Oh, all tumors start with this skin color there, which is on the top part there. There's more skin color. Now, of course, I don't know whether there's a hernia or not. I don't think so. Hernia also can have this intestine inside. Could be a hernia. No? You know what's a hernia, right? But can it shit and urinate? Okay.
Can.
Normal? Every day?
Yep, every day.
No difficulty?
No.
So it cannot be a hernia. Hernia also has this big swelling here. That is the inguinal hernia. Does she lick it? That's why it becomes blue color.
Lick sometime.
Lick possible. Yeah.
Then we come back.
Other than the appetite is still good. Appetite good, right?
Appetite good.
Eating, drinking okay. No, not over thirsty, right?
No.
Vomiting?
No.
Diarrhea? No.
No.
Temperature is normal.
After 12:30, no food.
No food, yeah. So, wait, so this, how old is it now?
Born in 2004, 2002.
Just wait and take temperature 38.4. Come, Judy, hurry up a bit now. Okay, come, you hold this. So I have a quick look below. Come. So it's come for surgery, but it's 16 years old, right?
Yeah.
The only thing is 15 years old. So the thing is that since they not much skin to suture, let me see. They can suture now. So the incision will be down below. So the skin problem is there will be a very big hole. A big hole. It's not. Is it? me see. So I need to cut higher a bit. Otherwise it can't close. Okay. So after that got to spay now. About 3 weeks later.
3 weeks later.
Otherwise it'll come back again the tumour because it's hormonal. It depends on the female. This not cycling, it has still got heat. No, right? Still having the 6 monthly.
They got 1 day only, a little bit.
Maybe got haematoma. Then this time was very bad, the teeth. So you can't do anything now for the time, you just do the tumour first. Actually there are 2 tumours up, but the other one is very small. There's another one here. This is very long, how long already? There's another one here. 1 year plus. So I will try to focus on this and do it in less than 30 minutes. So you don't waste time, otherwise you'll die of anesthetic. 2017, this old dog, about 16 years old, has this large breast tumor which you can see below, and it kept growing bigger and bigger, and it's quite painful to the dog. And I'm surprised it didn't get ulcerated, but it looks a bit bluish, so it's possible that it may become gangrenous, and so the owner has no choice but to take the anesthetic risk to get the breast tumor excised. Now the thing is, there's not much skin to stitch up. So wait, have a look, turn backwards. So now what we do is we clipboard. Come turn, let me see below, and turn backward. So you can see the extent of the tumor. So the best is to clipboard first, so that don't, and then wash up, prep first without sedation because it's a very old dog, and then give a nice warm wash, so that when it goes into the surgery room, I will be able to operate faster without wasting a lot of time doing prep. And so this is what my assistant is doing. She is clipping board, and then we really need to clean all this dirt. This is due to leaking, saliva stain, and then when everything is clean, then I will operate. Most likely I will have to have some skin here, go around, and then take out the tumor. Now there's a big artery and vein here called the caudal superficial epigastric artery and vein, and then this one will have to ligate and then close up. So far the dog has been on antibiotics for the last 1 week, and today is the operation day. Today is January 4th, 2017. This dog is going under gas anesthesia, starting with mask, then after the intubate. So we'll do F5 first, and normally I just take 3 liters per minute, 5 oxygen generator, and we started at 10:19, so it's already 10:21. So normally about 5 minutes to intubate, provided the mask is tight. Circuit is considered half open, the yellow half open or open, half open or open. We're not using closed circuit unless the assistant is very good at it. Closed circuit actually is the best, but it has to be very good at it. Most vets use open actually, which uses a lot more isoflurane. So they're preparing the dog for surgery. They use electrosurgery to cut the skin or coagulate. I'll do the anesthetic. Just do the anesthetic, yeah. Okay, so now we go to 1.5%. 1.5%. Okay, wait, 2 liters per minute. Half close circuit. Okay. Starting time, I could operate 10:40.
4th of January 2017.
Okay, those are really there. This is a haematoma. There's a dirty blood. Makes sense? Okay. Alright, you switch off first. Okay, finish. Come. Today is January 10, 2017. 6 days after operating on this dog with a large breast haematoma and tumor. This 16-year-old Jack Russell was operated 6 days ago. This is the image before operation. As you can see, this is not a typical breast tumor. This seems to be a bit bluish, suggestive of something abnormal. Normally a breast tumor is hard and solid and it's not bluish in color. So I thought there was some gangrene. But actually it's a haematoma or a cyst combined. Now, so this is the pre-op surgery. So now I will explain how I do the surgery. Now I will show the post-op surgery. This is a post-op surgery. As you can see, the tumor had been removed and the big hole in the skin had been stitched up using a Z plus T. Now, what I did was I extended the incision here and incision here extended, so that I can have more skin. So after extending the incision, originally there was a circle here, a big hole. So I decided to extend the incision, so it becomes like a Z plus T. If you can understand what I mean by Z. Z is like that. Like that. It's a Z plus T. So now I will show you the illustration of how it's done. Now, after the surgery, as you can see in this illustration, there's a big hole after removal of the left mammary gland, the 5th mammary gland, tumor and cyst. There's a big hole here, and this big hole is terribly big, about 6 inches times 6 inches. So as you can see, it's a large hole, and there's no way you can just stitch up one end to the other end. So what's the solution? So the solution is to do a skin flap, what we call a Z plus T. Now, as you can see, in this case, the big hole is here. Circle here, the big hole. So what I do was, I cut inside here, midline, make a long incision, and then there's another incision here to create the skin flap. So if you look at it, it is like a Z plus T. They call it Z plus T. Now, it doesn't look like Z plus T here, but in a way it's called Z plus T because if you see here, I extend the incision here and extend the incision here. So this is the midline, so here is one, so like that, down. So more or less it's like a Z. So in any case, after I use scissors to undermine the skin, so to loosen the skin folds around it, or around undermine, using scissors. As you can see in the video, after that, then I pull the flap down. There's a flap here. Then the other flap will be from here. Pull it downwards. And the third flap will be from here, the skin flap. And pull it all towards the central point, so that I can stitch up, stitch, 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 stitch. And so that's how I did this surgery. And the end result is, as you can see here, this is immediately after surgery. And as you can see, the stitches are more or less, they all meet together here. They meet together here, the flap, one flap, second flap, and the third flap. Third flap, so they all join together here. Then I stitch up the skin edges. Stitch up here, stitch up here, stitch up here, and then stitch up here. Stitch up here. Here there was an accidental cut, so it was stitched also. So this is how the big hole is closed up. And let's see. So this is the original, as you can see. This is definitely the big circular hole after removal of this big tumor, haematoma, breast tumor plus haematoma. And now we see 6 days after the surgery. Now this is the one. This is a slide. Okay, this is 6 days. Today is the 6th day. You can see the wounds are healing quite well, and the dog is eating and actually running around, which is not recommended. And there's no infection. Wounds are clean. The owner has not really cleaned up the blood stains here. This is a picture sent in by the owner by WhatsApping to me. This is day 6 days after the stitching up of the hole. And I just use simple interrupter stitches, 2-0, and certain parts I just use cross stitch to be faster, because the dog was already 1 hour into anesthesia, and the breathing and the heart rate wasn't that good. So this is a 16-year-old dog, and so it's best to be as fast as possible in your surgery so that the heart wouldn't fail. The dog survived, and then you can see the other parts of the video. This video is just to show the surgical procedures of closing up a big circular hole after removal of a big breast tumor, around 6 inches times 6 inches. 6 days ago. Toa Payoh Vets, January 10, 2017, Singapore. Time, what's the time?
11:23.
How many hours since the guess?
1 hour 4 minutes.
1 hour.
1 hour and 4 minutes.
Okay, finish the flaps here. Otherwise you can't close a circular hole. Just like that. Yeah. I tried the Z plus T actually, but there might be 2 Z plus T's here, so it seems to be. It seems to be. I'll turn to the side towards my camera. So that's how you close up the big circular hole there. The dog is going to wake up soon. Right? The time is quite a long time. You started what time? 10:19. Yeah. So nearly an hour or more than an hour. More than an hour, right? Okay, e-collar on.
Nè. Cái nè. Come on. Thiên Thiên. Mày. Nè. 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 You're not pain at all. Wait. Very good appetite. And she took out her pants herself. Took out the collar herself. Nice. I say don't move. This is how it look like. No swelling, no fleas. Very active. 1 foot